We have with us Dr. Ashok Seth from the Escorts Heart Institute, Delhi. Dr. Seth, acute myocardial infarction is a very common emergency faced by all of us. What is the best treatment in the Indian context? Because in the Indian context, there are lots of limitations.
I agree. In the Indian context, there are a lot of limitations, especially the patient getting to the right place for the right treatment. Now, there is no question in my mind that if a patient can get to a center which has angiography or angioplasty facilities worldwide, angioplasty, opening up the blocked arteries, putting a stent in, is the best treatment. Even keeping the Indian context in mind, where now the numerous government schemes which actually cover practically the whole population in many states, and in many states that's being successfully done on patients. But the real issue in such a situation is no more the affordability issue, which is now most of the population in India is being covered by for something like this, but the availability of angioplasty and stent implantation, though that is moving to smaller cities. So the first line treatment becomes as rapid institution of thrombolytic therapy as fast as possible, and then transfer to a center which can actually do an angiogram and if needed an angioplasty. So this sequence is important. Outlining those centers which can give thrombolytic therapy immediately is important, and outlining those centers which can do angioplasty gets very important, so that the patient knows in a whole state what is near to him and where the best treatment is going to be available. So it's a continuum of treatment rather than one or the other. The second aspect I must emphasize is that even in thrombolytic therapy, we in India at the moment are using streptokinase. That revascularization rates of streptokinase are low. We know 40% only people revascularize. Better agents which are now being made in India and at a less and are less expensive than they used to be, like fibrin specific agents like TNK, tenecteplase, can actually be used and are 80% efficacious, and I think that's where the whole process should be. We should be able to create a system of continuity, state by state, hospital by hospital, to help our patients have thrombolytic therapy and angioplasty.